Moderna hasn't said why it's reduced shipments to this country. A total of 2 million doses are supposed to come in by the end of March. Across Canada, about 142,000 people, or 0.37% of the population, have received 2 doses of either the Pfizer or Moderna vaccine. I'm joined now by Ronald Labonte. He is studies health equity at the University of Ottawa and joins us now to discuss more on Canada dipping into that COVAX reserve. Thanks so much for being with us.
Okay, you're very welcome, Janella.
I want to get your reaction to this story, Ronald, about Canada going for the COVAX vaccines. Do you think this is the right move?
It's an embarrassing move. If you are the government at this time and you're feeling all kinds of pressure from all sides about getting more vaccines into more Canadians more quickly, because we are way down, as you pointed out, way down on the list in terms of countries being able to roll out their vaccines per population, then yes, it's the right move. From a global perspective, it's not such a good move. It does put a rather dismal light on Canada's claim to sort of be back as a global player.
Oh, maybe take us back a little bit for people who aren't familiar with how COVAX got started and what role it plays now.
Well, once upon a time, in the early days of the pandemic, all the countries were sort of saying, we've got to work on this together. We've got to share all of our forces to sort of find a way to get out of this pandemic, to sort of cure the pandemic. And the World Health Organization stepped in and helped to create something called the COVAX facility. And part of the COVAX facility is actually something called the COVAX Technology Access Pool. And that was to try to encourage pharmaceutical companies that were then busily getting public money to create a vaccine to share that knowledge, to make it open, to make it public, so that all kinds of different manufacturers would be able to sort of very quickly scale up on successful vaccine discovery. So far, none of the pharmaceutical companies have done that. None of the patent-holding pharmaceutical companies have done that. At the same time, it created a mechanism of basically going to high-income countries with the money and the capacity to spend it, to say, we'll make some of our vaccines available to you at our COVAX situated price. In return, can you donate money to a pool that we can use to access vaccines for low and middle income countries? Canada, as you pointed out, has taken advantage of that. So some of the funds it sent to COVAX was intended to purchase vaccines for Canadian consumption. That was always going to be the case. And when COVAX made that offer to countries, it said, well, for high-income countries, we've got to give them something back to kind of coax them into giving more funds into the pool that will then be used to purchase vaccines for low and middle income countries. Canada also was fairly generous in being able to provide financing to that particular pool for low and middle income countries. So in that sense, the government is correct. It's doing exactly what it said it was going to be doing. Does it look good? No, it doesn't look good, because we have a critical undersupply of effective vaccines in terms of production capacity at the present time. So Canada is basically scrambling around to sort of say, where can I get this stuff? Where can I get it? It's unfortunately, the longer it takes for us to have an adequate supply of vaccines for the entire world, the longer it's going to take for us to reach global herd immunity. And until we do that, everybody on the world is going to be at some risk of the present pandemic or any variant that gets produced of that of the SARS-CoV-2. If we're not able to increase rapidly the supply of those vaccines, it's going to hurt Canada. So Canada might be taking care of itself in the short term, but until it also is able to assist in taking care of the whole world, also in the short term, in the medium term, it's going to come back to bite us.
I mean, to that point, 1.9 million doses, are we putting other countries at risk? But you say not just other countries, we're putting ourselves at risk too.
Over the long haul, we are putting ourselves at risk. You can take some perspective on this. 1.9 million doses of a vaccine that may only be applied once. I'm not sure exactly what that would translate into potential vaccinations. But if we assume it's 1.9 million, that's a tiny number in terms of what the global supply that we need. So it's okay to be critical, but at the beginning, the whole way we went about this, and all the high-income countries, Canada included, but all the others went about it, was wrong. They all started getting into these binational advanced purchase agreements with the vaccine producers who were going to produce this stuff heavily funded by public monies and then be able to put a patent on it and control the distribution and manufacture. So they're the ones that determine where is it going to be manufactured, what will the prices be, which they kind of negotiate with the countries that have entered into these purchase agreements.
Sorry, finish your thought.
Yeah. Basically, that was never the intention of the COVAX facility. That was never the intention originally. The idea was that everybody would pool together, and that would include the patent-holding pharmaceutical companies. They're on this technology access pool that exists. 18 generic drug companies have joined. Not a single patent-holding pharmaceutical company has joined. They want to keep their patents.
So this just hasn't unfolded in the way that it had initially been kind of set out. I do want to ask, though, one question, because the Prime Minister, has constantly said that Canada has one of the most diverse vaccine portfolios. So the fact that they've now had to turn to COVAX to get their supply there, what does that reveal also about Canada's ability to get vaccines on this global stage?
Unfortunately, it doesn't reveal anything because all of the terms of those advanced purchase agreements with the vaccine manufacturers they've not been released. We don't know exactly what the terms of those agreements are, what Canada is obliged to pay, how much is supposed to be delivered on time. All we're hearing is that when we don't get it and countries get upset because they're not getting what they're supposed to be getting, we don't know what the details of the arrangements are. We don't even know the details of the arrangements around COVAX is negotiating to purchase the vaccines for distribution to low and middle income countries. There's been an incredible lack of transparency or openness about this whole process.
Just quickly before we go, in your eyes, where do we go from here? How do we move forward? Because it seems like we've kind of gone off track.
There's a number of us have been pushing on an initiative that is supported or initially advanced by developing countries. It came out of South Africa and out of India. It's now supported by more than 100 of the developing country members of the World Trade Organization. And this initiative says if we're really going to get out of the supply crunch that we're in, we need to make it possible for all of the potential vaccine manufacturing facilities globally to very rapidly start to develop and produce the vaccines that we do know now are effective. And that requires that we change the rules in the TRIPS agreement. So South Africa and India and these developing countries have advanced a motion to the World Trade Organization to have a temporary waiver on certain aspects of that TRIPS agreement regarding patents and trade secrets and so on. Right. Until the WHO declares that the pandemic is over. Unfortunately, a number of high-income countries, the very ones that have scored all of the vaccines already, who are struggling like Canada to get them wherever they can, are opposing that waiver because they want to support the patent system for pharmaceutical companies.
Right.
That part just doesn't make any sense. I mean, Canada would really be doing itself and the whole world a favor if it actually came out and supported that TRIPS waiver.
Okay, Ronald Labonte joining us tonight from Ottawa. Thanks so much for sharing your thoughts.
You're very welcome. Thank you.